Hi, Mr. Jones. It's Jane calling from Ward 4. It's about your patient, Mr. Smith. He's 4 days post-op and he's not very well this evening. Oh, you want his OBS? 1 minute.
Sbar, or Situation, Background, Assessment and Recommendation, is a structured method for communicating critical information to colleagues. Begin by identifying yourself, where you are calling from, the patient's details and the reason you're calling. Describe your concern to your senior colleague.
Good evening, Mr. Jones. It's Jane, one of the SHOs that's on call this evening. I'm calling from Ward 4 about a patient called Stephen Smith. Yeah, he's a 45-year-old gentleman, 5 days post-lap chole. Looking at the op note, it looks like it was quite a difficult procedure that was converted to open due to a difficult dissection around the bile duct. I've reviewed him as he's had an increased abdominal pain over the last couple of days, and this hasn't really settled with increasing amounts of opiate analgesia.
Give the date and reason for admission, any procedure since then, any relevant medications, and any past medical history.
Well, he was admitted to the ward 5 days ago after his surgery. He's normally fit and well, doesn't take any regular medications, and doesn't have any allergies. Since he's been with us, he's had some regular simple analgesia such as paracetamol, and also this evening increased in amounts of morphine. He's on day 5 of a course of oral coamoxiclav. Looking at his bloods, his white cells and CRP are showing an upward trend over the past 3 days.
Inform your senior of the patient's current vital signs and your clinical impression. Highlight the main concerns you have about the patient.
He's febrile with a temperature of 38.8 and tachycardic with a heart rate of 135. His blood pressure is maintained at the moment. On examination, he's cool peripherally and his urine output has been reduced. His abdomen is soft and very tender, especially in the right upper quadrant. His wounds look clean and dry. I'm concerned that the patient might have a bile leak or a collection developing.
Explain what you need from your senior, making sure you're specific about your request and the time frame. Suggest a management plan and clarify this with the person you're speaking to.
I think this patient really needs an urgent senior review as soon as possible. Would appreciate if you'd be able to come down and see him. In the meantime, I'll give him a fluid bolus and send off some urgent bloods. Is there anything else you'd like me to organise?
The Sbar Tool is a structure that enables good communication of critical information requiring immediate attention. This is essential for the safe delivery of care to our patients.